then, okay, so we're now talking about the pure tone screening. This is the GSI 39. This is what we have in our clinic here. This is the screening audiometer. We have already plugged in, well, this is the cord for the tympanometry. This does not unplug, so this will just stay. We've plugged in headphones, and you'll notice red, blue, red is right, blue is left, and it's even red dot on the back of the machine, left dot, left, blue dot for the left ear. And then if you look at the headphones, they're also marked red right, blue left to remind you when you're putting them on, so you put them on properly. You'll have to plug in your headphones. Here's the power cord that will need to be plugged into the wall. You'll have to take that apart as well. Whenever you're setting up for pure tone and tympanometry, make sure you are seating the patient away, like we have the chair right here, so that the patient's back is facing the machine or where the clinician is going to be setting. That way we're not giving any visual cues during testing. Also make sure that the room is quiet, especially for the pure tone portion. Doesn't matter so much with tympanometry, but it will for the pure tone screening. And then remember, you need to be the one to place the headphones on your patient. You also need to be the one to provide instructions to your patient. Tell them what they need to do before you put the headphones on them, because if you don't, they don't hear you very well. If you look at the headphones, you see this center portion right here where the sound comes out of. You just need to make sure that you're putting it over the ear so that that little middle is directed toward the ear canal, okay? And then adjust the headband accordingly, up and down. Once you do that, then you can begin testing, and if you'll walk over here really close, I'll show you. On and off switch is right here. It's always a good idea to start by doing a check of the equipment, put the headphones on yourself, and give yourself a hearing screening and see if you're hearing the beeps. Move the cords, see if you hear any static. Make sure that when you present a tone, you're hearing a tone. Change the level of the volume to see if when I turn it up, it gets louder, when I turn it down, and that sort of thing. This is the presentation switch. When you push here, that's how you present the tone. This is adjusting the intensity. So when you turn to the right, it's getting louder. This is kind of like a little audiogram. 0 dB at the top, 100 at the bottom. So when I turn left, I'm getting quieter. When I turn right, it's getting louder. And then when I move from left to right, these arrows, that's how I go from the different frequencies. So like here's 1,000 hertz. We talked about starting at 1,000 hertz in the right ear. You would present the tone at what level for screening? Look on your form. It's telling you to screen at 20, so you would set your dial to 20 dB. We're at 1,000 hertz. You've given your instructions. Present the tone. Did they respond or not? If they respond, then I move on to 2,000 hertz. Present the tone, and then mark their response or not, and then keep going until you've tested all the frequencies listed at 20 dB. All right, and then when I'm ready, I switch to the left ear here. Another thing, just housekeeping, this is the erase button, so any temps, anything that could be stored in here, it's always nice if you'll just start your session by pushing the M minus to delete everything in there. Otherwise, if you press print and somebody has done like tympanograms before, then all of that would print. When you're ready to switch to tympanometry, you go here to temp, and then this activates the probe tip here. You're going to have to pick a probe tip that's appropriate for your patient. The tip should not go too deep in the ear. It should firmly seal the outside of the ear canal. You want a complete seal for adult patients. You're looking at the red, blue, green. Some of these yellows, really big ears, mainly older men with very large ears, would be the yellow. But these three right here, sometimes the yellow are the most common. Toddlers would be this. Really, these ones down here are infants. Okay, so you really shouldn't be using those unless you're testing tiny, tiny babies. You'll pick the appropriate earpiece, and then do you want to sit down and I'll model on you really quick, just for the video, and then you guys can practice. So I'm going to pick the blue. I put it firmly on the end, no twisting or turning, just place it firmly on the end. And then if you'll notice there's a green light here flashing. Again, up and back to straighten that canal. Get a seal, and then you might step right behind me so that you can get the light. See how the green light went stable, solid green, you felt the temp, and then looky here at our result. What type of tympanogram do we have? Do you remember that? We went over the different types. We have a nice peak right at 0. That's a type A. That's a type A tympanogram. And remember with tympanometry, you have to interpret those results. Okay, it doesn't give you pass or fail like the OAE did. So this is a normal result. You're normal. Congratulations. Okay, so I'm going to let you guys go ahead and test each other. There are some wipes if you want to wipe down the headphones. These tips are disposable. So since he's already got his tip here, I'll let you, maybe you test him first. How about that?